Hi, my name is Colin Jarvie, and in this video I'm going to be showing you how to perform basic CPR. The first thing you're going to want to do is identify the patient. You're going to see someone laying on the ground, and they're most likely going to be unresponsive by the eye. What you want to do is get down to the level and make sure that they are officially unresponsive before you take any actions. You first want to do is say, hey, are you okay? Can you hear me? At that point, if they don't respond, that's when you're going to want to check for vital signs. What you're going to want to do is take your pointer finger and your middle finger. You're going to take them just like this and place them on the carotid. Doesn't matter which side. Take it and place and feel for a pulse. And while you do that, you're going to want to go down to the airway and check if they're breathing. As such, you're going to want to check for equal rise and fall of the chest when doing this. One thing you're going to want to make sure you do while doing this as well is make sure that their airway is open, and you're going to do this by performing a head tilt chin lift. So you're going to put your hands on the back of their head, scoot it backwards, and kind of lift their chin up to make sure that they can breathe. If either of their vital signs are missing, whether that be their heartbeat or their breathing, you're going to perform CPR. But if they're not breathing, you might have to do the Heimlich. It depends on what's going on. But if there's no heartbeat, you're going to immediately want to start CPR. So you've now identified that someone needs CPR. What you're going to want to do is tell someone to call 911 and find an AED. If there's no one else around, what you're going to want to do is call 911 yourself. If you don't remember how to perform CPR, 911 will also give you instructions on how to perform CPR. Next, what you're going to want to do is take your two hands, put one out in front of you, place the other, close your hand and close the other one just like this. That's the grip you're going to want for CPR. Now you're going to want to locate the sternum, which is going to be the middle, hard, bony portion in the middle of the chest, right here on this patient. You're going to put your hands just as such, straight arms over your patient. This is a position you want to be in when performing CPR. This allows you to allow adequate pressure and speed when doing CPR, because you want to make sure you're getting to the proper depth and speed. When doing CPR, you want to be about 2 to 2.5 inches for an adult when doing CPR to make sure that it is adequate. And you want to make sure you're going at about 100 to 120 beats per minute, about the same beat as staying alive. So I'm right now going to perform CPR for your demonstration. As you could see, I was over the patient the entire time. I wasn't going too fast or too slow, and I also wasn't pushing too hard to where they couldn't be in a lot of pain. I also wasn't pushing too late to where they couldn't feel anything.
The video monitoring system has resumed.
Sorry about that. Next, what you're going to want to do is, if you're going to be performing emergency breaths, it's going to be at a ratio of 30 beats for every 2 emergency breaths. If you're not comfortable performing emergency breaths, you don't have to. For example, I'm going to show you how to do the 30 to 2, but I will not do mouth-to-mouth resuscitation at this time. And then at this time, you would then do 2 breaths to make sure that their chest rises each time. That is how you perform 2 immediate emergency breaths. Now, you will continue CPR until someone who is better, more qualified, or an EMT or paramedic takes over for you. If no one can come, you must continue CPR until someone does. Once someone comes to take over for you, you will tell them how long you've been doing CPR and the state that you found them in. 2 things you're going to want to be aware of is that when they come, they're going to want to just push you away, and that's okay. You're going to want to let them do what they do. And next, you're also going to want to make sure if you are able to get a hold of an AED, that you use it. They're very simple, and they read out the instructions as it happens. Thank you very much for watching this video. I hope this helped out a little bit. If you ever need to use it, now you know the basic idea on how to do it. Thank you.